Good morning to my fellow classmates and to Dr. Chen. My name is Vijay Sivanathan, and the topic that I'll be explaining in this presentation is bacterial pneumonia. So, what is bacterial pneumonia? Bacterial pneumonia is basically the inflammation of the lung that is due to bacterial infection. There are four types of bacterial pneumonia: community acquired pneumonia, which is CAP, hospital acquired pneumonia, HAP, healthcare associated pneumonia, HCAP, and ventilator associated pneumonia. Now, I'll be basically explaining what these four things are. CAP refers to the acute infection of lung tissue in a patient who has acquired it from the community. HAP refers to the acute infection of lung tissue in a non-intubated patient. VAP refers to a type of nosocomial infection of lung tissue that usually develops 48 hours. HCAP refers to the acute infection of a lung tissue that is acquired from healthcare facilities such as nursing homes and dialysis centers. So after explaining about what these things are, I'll move on to talk about the pathogens that are involved in bacterial pneumonia. The pathogens have been categorized into two divisions that is called atypical and atypical organisms. The bacteria that causes typical pneumonia are Streptococcus pneumonia, Haemophilus influenza, Staphylococcus aureus, and Morozella catarrhalis. Whereas the bacteria that causes atypical pneumonia are Legionella, Chlamydia pneumonia, and Mycoplasma pneumonia. Besides that, the most common cause of CAP is Staphylococcus pneumonia, followed by Klebsiella pneumonia and Haemophilus influenza. Whereas the most common causes of HCP and HAP are MRSA and Pseudomonas aeruginosa. The causative agents of BAP include MDR agents. So now, after talking about that, I'll move on to talk about the biology of the pathogens. The first pathogen that I'll be mentioning is Staphylococcus aureus. Staphylococcus aureus cells are gram-positive and they appear in spherical shape. They are often in clusters resembling bunches of grapes when observed under light microscope after gram staining. Shown in the image above, this is an image of a Staphylococcus aureus. Staphylococcus aureus are known to be coagulase positive and they are also non-motile. The next pathogen that I'll be talking about is Streptococcus pneumonia. Streptococcus pneumonia are bacteria that have lancet shape. They are gram-positive and they are facultative anaerobic organisms. They are typically observed in pairs, which are diplococci, but may also occur singularly or in short chains. Most pneumococci are encapsulated and their surfaces are composed of complex polysaccharides. The third pathogen that I'll be mentioning is Haemophilus influenza. They are small gram-negative rod-shaped bacteria. They are also encapsulated. They are non-motile and non-spore forming gram-negative Coccobacillus, which often cause severe pneumonia. These bacteria live in your nose and throat, but they don't usually cause any harm. However, when these bacteria move to other parts of your body, they can cause infections. Next, I'll be talking about the regions that are affected by bacterial pneumonia. According to the World Health Organization, it showed that bacterial pneumonia are the highest in South Asia and Sub-Saharan Africa. This can be further supported by the World Vision, which also provides the top 10 worst places that are affected by bacterial pneumonia, shown in the diagram below. The diagram below indicates that India has the highest population of bacterial pneumonia cases, and Angola has the lowest bacterial pneumonia cases. Following that, now I'll move on to talk about the clinical signs and symptoms of bacterial pneumonia. The first clinical signs and symptoms is they'll have high fever to up to 105 Fahrenheit. They'll be coughing out greenish yellow or bloody mucus. Next, they'll also have chills that make us shake. They'll have difficulty breathing and also they'll have confusion. Other than that, they also feel very tired. They'll have sharp chest pain, fast breathing and heartbeat. They'll sweat a lot and they'll also have low appetite. So these are the common clinical signs and symptoms of individuals that have bacterial pneumonia. Moving on, now I'll talk about the mode of transmissions and the time taken for the infections to spread. Pneumonia can spread when droplets of fluid containing the pneumonia bacteria are launched into the air, when someone coughs or sneezes and then inhaled by others. Pneumonia can also spread through indirect contact. Examples of indirect contact is when an uninfected individual touches a surface that was touched before by an infected individual. Following that, bacteria the living under the nose, sinuses, and mouth may also spread these pathogens into the lungs. Now, following that, I'll be talking about the time taken for the infection to spread. The approximate time when pneumonia becomes contagious may range from 1 to 2 days and also 2 weeks. Besides that, I'll be talking about the pathophysiology of bacterial pneumonia. The streptococci reaches the alveolus and lead to inflammation and pouring of an exudates into the spaces. White blood cell migrates to alveoli. This will then cause the alveoli to become more thick due to its filling consolidation, involving areas by inflammation that are not adequately ventilated, this is due to the secretion and edema. Besides that, this will then lead to partial occlusion of alveoli and bronchi, causing a disease in alveolar oxygen content. This is the reason that individuals may have breathing difficulty as one of the symptoms. This image basically shows a healthy individual that doesn't have pneumonia on the left, whereas on the right, it shows the alveolus of an individual that has pneumonia. It's shown that the alveolus of an individual that has pneumonia has fluid in the alveoli. Now, I'll move on to the treatments that are used to basically treat this particular infection. Bacterial pneumonias are usually treated with antibiotics. Amoxicillin is the recommended treatment for the bacteria that commonly cause pneumonia. If the patient has a reaction to the amoxicillin, doxycycline or clarithromycin is recommended as an alternative. Over-the-counter medications are also commonly prescribed to better manage pneumonia symptoms. These include treatments for reducing fever, suppressing coughs, and reducing aches and pain. In addition to that, it is also important to get plenty of rest and sleep and drinks a lot of fluids. Replenish yourself. Hospitalization for pneumonia may be required if symptoms are especially bad or a patient has a weak immune system or other serious illness. At the hospital, patients generally are treated with intravenous antibiotics and are possibly put on oxygen if required. Now, I'll be talking about the prevention of bacterial pneumonia. There are two types of vaccines that can be used to prevent bacterial pneumonia. Prevnar and Pneumovax are the two vaccines that can be used to help prevent the infection from happening. Prevnar is generally administered as part of the normal infant immunization procedure and is recommended for children less than 2 years of age or between 2 and 4 years with certain medical condition. Pneumovax is provided for adults who are at increased risk of developing pneumococcal pneumonia, such as the elderly, diabetics, those with chronic heart, lung, or kidney disease, and those without a spleen. The pneumonia vaccine may not completely prevent older adults from getting pneumonia. However, it can reduce the severity of the future pneumonia. In addition to that, physicians recommend that people wash their hands, refrain themselves from smoking, eat healthfully, exercise, and stay away from sputum or cough particles from others with pneumonia. These are the few ways that we can take to prevent bacterial pneumonia from taking place. Now, lastly, I'll be talking about one of the outbreaks that happened in a long-term care facility on bacterial pneumonia. This is basically an example of that shows that how important it is for us to take measures to prevent this disease from spreading to other people. These are the references that I have used for this presentation. Thank you very much and have a great day.